This is a problem of a corn. A corn is actually a type of a callus. It's present in the foot, and it starts because of the problem of bad toes. Can't see it in this particular field of view, but these toes are very irregular, and so are the bones, and therefore this bone right here that runs down this way takes more pressure than the other bones. In turn, what happens is the skin here begins to rebel or react against this undue pressure. Instead of handling 1/10, there are 10 toes, but handling 1/10 of the weight of the body, this particular toe is having to handle more than its fair share. So the skin produces a reaction. It's a thickening of the skin, and the rounded area here is called a corn. Sometimes corns also can become or occur from warts. In this case, the first thing to do is try to soften the corn. On this swab is some lactic acid, 66% lactic acid. It's worked into the skin, as I'm doing, and it absorbs. And it may take, at first when you're doing it, 5, 10, 15 minutes. You don't have to stand there and do it all the time, but come back until you begin to see that the area is taking up the lactic acid. After that, you can put some duct tape on. Simple as this. It doesn't have to stick too well, but it helps the medicine to absorb. Now, because it is lactic acid, sometimes it can penetrate. You don't want it to run down between the toes. A little bit of Vaseline in those areas helps to stop that. After a few days, you can then take a number 15 scalpel and begin to whittle. I'm not going to do the whittling here, but it's a motion like this, and begin to cut the warty area. It's not a true wart, but the warty-like area down. In other words, the corn. After a while, and unfortunately I don't have a corn pad, but after a while you can put a corn pad around which has a hole in the center. In doing this, this keeps a lot of pressure from when you're walking on your foot. It keeps a lot of pressure from riding right in there. In other words, the pressure is taken up around the area, and in doing so that helps to relieve the corn. This takes a good while. Nothing's done quickly. These corns form slowly. They're bad about coming back again, so this is a lifetime event of using lactic acid. Sometimes we use salicylic acid, covering it with the duct tape, and whittling. The problem with corns are that they can begin to spread, so it's important to keep the corn completely under control at all times.